Good morning. I apologize for my very poorly timed laryngitis. Please bear with me. I'm going to ask you all to do something a little uncomfortable for a moment. I'm going to ask you to try to imagine what it would feel like to be homeless. For many of us, I'm asking you to imagine the unthinkable. But the reality is that for many people in this country, they're just a few bad things away from that unimaginable scenario. So let's say you get sick, you go into medical debt, you lose your job, can't pay your rent, and you're evicted. You spend that first night sleeping in your car trying to figure out how this happened until you realize it's time to find help and you seek out the nearest shelter. Now imagine you wake up in this scenario in March of 2020. The food banks and the soup kitchens where you got all of your meals have closed down. The water fountains at the parks that you always relied on have been shut off. You keep hearing rumors about this deadly disease that's spreading from person to person, and the only guidance you hear on the news is to stay at home, but you're homeless, so that doesn't apply to you. And you have no choice but to sleep in a crowded shelter because it's freezing outside. So this nightmare that I'm asking you to imagine was a reality for over 500,000 Americans in 2020. I'm an associate professor of public health and biomedical engineering here at Purdue. I work on rapid diagnostic tests, both in the lab, and I also think a lot about how to take them out of the lab to community settings where they're most needed. In 2020, I was contacted by a local shelter who was having trouble getting their folks tested for COVID. And it was impossible to tell who was infected and who wasn't in this crowded homeless shelter. And so to me, it seems they obviously needed rapid tests and vaccines for that matter. So in my infinite wisdom as an expert, I was like, hey, you should probably get all your people vaccinated and you should offer rapid testing at your shelter. And my amazing now community partner, Jennifer Layton, who's here, thank you for coming, at LTHC Homeless Services, she looked at me and she said, that's a lovely, lovely thought. I can't even get the folks in my day room to wear masks. They're certainly not gonna let us stick something up their nose, and they will most likely not be getting vaccinated. So it was clear that my expertise meant very little here. I had absolutely no legitimacy as an outsider to this homeless community. I have no personal experience with homelessness. I knew nothing about their daily life and struggles, nothing that I could relate to even. And it was clear that I was going to have to relinquish any authority that I had as a researcher or expert and really let the community lead. I had to figure out how to engage them and build their trust to identify their specific needs and priorities and work together to arrive at meaningful and practical solutions. So that's what we did. We started community engaged research to improve pandemic response in homeless shelters, and we started by listening. So we hired 2 community health workers. Their names were Nick and Becca. We trained them to talk to folks at the shelter, figure out what they needed, what they wanted, begin building their trust. And we started by asking first what they wanted, not what we assumed was needed. And it turns out what they wanted was help getting their stimulus checks. At the time, you just needed a bank account and a home address. Most folks had neither. And so we had to figure out how to help with that, and our community health workers were able to get over 50 people their stimulus checks. This made Nick and Becca very popular at the shelter and kind of the go-to people. So we then trained them to provide health education about COVID in ways that were informed by the community and guided by their questions. So, for example, why should we wear a mask? Well, we would show them those droplet videos of people sneezing with and without a mask on. Is it true that the government put chips in the vaccines so they can track us? And that was what started multiple sessions to dispel myths about the vaccines. And little by little, you saw people much more willing to engage in preventive health behaviors. There was a lot more interest in the vaccine. Our health department ended up doing multiple vaccination clinics on site at the shelter. We also learned that almost everyone was willing to get tested as long as they could do it at the shelter and they could swab themselves. So we did that. We gained a much deeper understanding of their specific barriers to healthcare. So we no longer were relying on kind of the misconceptions and the assumptions that we heard before about, they don't care about their health or they're unwilling to see a doctor. We now had a much better understanding of their specific needs. And so we didn't rely on that hearsay. And we could work with them to arrive at some meaningful solutions to address them. So this was the story of how we created this community academic partnership, to meet folks where they are, to design strategies and health technologies to bring preventive health care to them. We've been doing this for about 5 years now, this community academic partnership, almost 5 years. It has provided this forum for bidirectional dialogue between the community and the university around issues of homelessness and health disparities. And this has garnered millions in research dollars from the National Institutes of Health. My lab, for example, just launched a 5-year study trying to understand different strategies to improve healthcare delivery in homeless populations. So we're starting with addressing disparities in cervical cancer. Many women in this community refuse traditional pap smear screening because of historical rates of sexual violence and trauma. And so we are bringing cervical cancer screening to them by letting them swab themselves in the bathroom of the shelter. And these kinds of strategies, what we call self-sampling, are actually changing the game in public health, and we can take very little credit for them because most of these ideas came from the community. They brought the ideas to us, and we just wrote the grants and designed the studies to test them. This work is growing. This approach has allowed us to expand in different directions. We have faculty here in this community academic partnership, in nursing, in pharmacy, in public health, that have taken new directions proposed by the community around issues of food security and nutrition, women's health, family and youth resilience. And our group is growing, and it's making a difference. And we've learned some valuable lessons along the way that I want to share with you. The first is that collaborative science is the best science. I think I'm preaching to the choir here, but everything we learn from the community every day changes the way that we do science. It changes what we know about public health and about disease prevention. The second is that community-based research forges connections that allow local organizations to feel very real ownership over the work. So about 25% of our research dollars has gone directly to our partners in order to serve as the community home for the research, but also to build the necessary capacity so that work is sustainable and really to empower them to be their own agents of change. And the third is a personal one. This work has really forced me to learn to listen. I have trained at some of the most prominent research institutions across the country, and those few visits to the shelter in the beginning, those conversations that ensue really taught me how little I knew. My academic expertise didn't prepare me for the lived experience of homeless communities, and I really had to take off that expert hat and invite the community to lead the way. I never thought I'd be doing work like this. I'm a biomedical engineer. I trained in a wet lab. But this work has fundamentally changed the way that I view my own research and also how I view science more broadly. I think here at Purdue we have some very brilliant minds, many in this room, working on groundbreaking discoveries right now. But in order to make sure those discoveries make it to people who need them and to really heed our land grant mission, we really need to leave our labs and leave our offices and spend time in the communities we hope to serve and start listening. I think this will lead to better science, a more robust and more relevant research enterprise, as we've heard, and better health for all. Thank you.